Child Health Nursing from Omayal Achi College of Nursing, Chennai. Currently, Madam is pursuing PhD in Nursing under National Consortium. She has an additional qualification in PG Diploma in Child, Adolescent and Family Counseling from Kerala University and PhD Diploma in Medical Law and Ethics from National University of Advanced Studies, Kochi. Madam was the board member study member of nursing in Calicut University. Madam has great achievements incepting MSc nursing program in self-financing sector in Kerala at Mar Basilius College of Nursing, Kodamangalam, and instrument in bringing DME and DNB for post-MBBS educational program in Almas Hospital. Her passion is to volunteer of educating teachers, mothers, and adolescents in nearby schools and Anganwadis, and also interacting with mothers and children with all age. With great pride and honor, let me invite Professor Rati M. to take over the session. Over to you, Madam.
Good morning, dear organizers. At the outset, let me thank Lourdes Educational Academy and the principal, especially Dr. Sendil Kumar, for giving me this opportunity. When he offered me, Madam, would you like to take a class on growth and development? It was like taking me to a sweet shop and asking me, which sweet, Madam, please choose the sweet. All sweets are tasty, all have their own flavors. That is how I view children. Children are wonderful. And it is always a pleasure, especially when you consider this growth and development, because the whole new world is opening up before the children. And when a blind person has been sent for surgery, and when he is about to open his eyes, how he is going to view the world, that much beauty comes when a child is also born and is growing up. So through the child's eyes, we see the world in a whole new way. And therefore, I do enjoy taking a class on growth and development. And I am sure maybe I will be able to live up to your expectations. If there is any doubt or if I have missed anything out, please do excuse me. I will try to do full justice to the topic which has been given to me. Yes. Am I audible to all?
Yes, madam, you are audible. Fine,
Okay.
fine. Yeah, you can start the slide sharing,
Yes,
and
yes.
it is going to be on live as well. Johnson, just have a look at the YouTube live, please. And the friends, please, if some of your friends are not able to come inside the Zoom, please ask them to view the YouTube live, please. And thank you, madam. Please continue the session. Thank you.
Yes, yes. Thank you. So the topic that has been offered to me, or maybe I would rather tell I have chosen it, is the stage called the preschooler. So from the name itself, we can identify the main task or the main importance of this stage is readiness. So readiness for an adult life, readiness for going to school, for scholastic achievement. So it's the growing up stage. So the preschooler. Any session on growth and development, even if I'm going to start from preschool, already you have had 2 sessions. Still, I would deem it necessary that I should give a definition on growth and development. So as we all know, or you must have heard through these 2 days, growth denotes a net increase in the size or mass of a tissue. It is largely attributed.
Sorry for the interruption. Did you start sharing the slides?
Yeah, I think I have done.
Johnson, is it visible? The slides are visible?
Madam, slides are not visible.
Madam, please share the screen, madam, please. I think the process of sharing the screen is not yet completed. Yeah, it's coming up, madam. Yeah, fine, great. You're okay now, madam. Now we got the first slide, actually. Now you move on, madam. Thank you.
Yes, I hope the slides are visible now. So we move on first with the definition of growth and development. Growth denotes a net increase in the size or mass of a tissue. So we call it as hypertrophy, isn't it? Becoming bigger. It is largely attributed to the multiplication of cells. So we have a large increase in the number as well as in the size. And this growth is visible and it is measured in terms of height and weight. In contrast, development refers to the maturation of the functions. It is related to the maturation and myelination of the nervous system. So here, for development, it is the nervous system which is very much important. We have studied in anatomy about the axons and the neurons and the membrane covering the axons. That is the myelin sheath. So the myelin sheath, as it gradually begins to cover the axons, we get this maturation. And that maturation results in the development. And development here, it means the acquisition of a variety of skills for optimal functioning of the individual. So if we have to live, from the time we wake up in the morning till night, we use various skills. We use our hands, we use our legs, we use our senses. So all these, when they are used properly to an optimal level, it is the development. So here we understand the biggest difference between growth and development. Growth is increase in the size as well as in the number, whereas development, it is the maturation of functions as a result of myelination of the nervous, myelination of the axon. Now, again, all this may be a repetition, but it is important for us to know these before we go to the growth and development of any stage. That is, the first thing is the need for studying growth and development. So the series was begun now. What is the need for us to study about this growth and development? So we have to look from the angle of ourselves, we have to look from the angle of the child, we have to look from the angle of the parent. So for the child, how it is going to influence, how studying of the growth and development will be useful for them. So for children, we already saw that in every stage, the development is different, the growth is different. So if a child has to be brought up well, and the child has to reap the benefit of his being born and living in the world, the parents and the elders around have to rear him up properly, him or her properly. Therefore, the study of growth and development is of ultimate benefit to the child. Now, what is the benefit for the parents in studying about the growth and development? Of course, it is the best thing for a parent to achieve is to rear and bring up good children who will be productive for the country, peace-loving individuals who will be productive for the world as a whole. So the study of growth and development is a real boon for the parents. Now, what is the need for us to study about the growth and development as health-related professionals? Now, the studying of growth and development first will help us to know every stage, what are the differences in the growth and development in every stage. That is a basic thing we need to know. And how this knowledge is going to help us. In every stage, the needs are different, the problems are different, the guidance which we have to give is different. So unless we study this growth and development, it is not possible for us to guide a parent or a child towards achieving the optimal development. Also, the study of growth and development helps us to identify deviations from the normal. The growth and development also helps us to provide anticipatory guidance to the parents. And we also know diseases. The progression of diseases is different in various stages of growth and development. Therefore, by studying growth and development, we will know the right point where we can tackle the cause and bring about a progress. That is the need for studying growth and development. Now, what are the characteristics? This already, I'm not going deep into these three topics. Characteristics of growth and development. We know it is unique to every individual. We know they have their own rate and space. We know they go parallel. And it is there are certain times when growth is fast, when growth is slow, like called as growth spurts. So these are some of the characteristics. Factors affecting growth and development. We know heredity and environment, those are the main two important factors. Other than that, we have exercise, drugs, diet, hormones, various other interplay which affects the growth and development. So this is a small introduction into our actual topic. Yes, so these are the various stages which already would have been shown to you. The prenatal stage, stage of infancy, the stage of early childhood, the stage of middle childhood, and late childhood. So under early childhood, we have two groups, the toddler and the preschooler. So my topic here is concerned with this age group. The child who is just completed has begun 3 years and about to complete 6 years. So 3 to 6 year age group comes under the preschool group. Now, our important what to tell achievements is when we look at a child itself, we should be able to tell what stage the child begins to, especially in infancy and all. It is wonderful when you're able to locate what month the child is in by looking at its development. So infant, we all know the baby will be lying down. Gradually, it will be on its knees. Then it will try to stand. And the next stage, toddler. Toddler, we know it is the baby is special, looking special. It has a pot belly. It has a bow legs. The head is big. And in the same way, for the preschooler also, there are wonderful physical characteristics by which you can identify them. A toddler who was pot belly, a toddler who had a bow leg, a toddler who had a big head, slowly changes its body proportions. Look at this child. So the child is slender. Slender, it becomes thin. The thinness is mainly because of the muscle tone is developed, and second is the child begins to do a lot of activities. The child is very active, and therefore majority of the preschoolers are thin. They are sturdy. Sturdy is because of the good skeletal development and the muscles are formed. Therefore, they look strong and they are not wobbly. Toddler, when we tell the name itself indicates they toddle. They are not stiff. They are not rigid. But here the preschooler is sturdy. They are graceful because they want to please us. And so they have a very good demeanor. That is what we call as graceful. They are agile. They are very swift because of the development of the motor system and their increased curiosity to understand the world. They are very swift and they are very fast, and they have a erect posture. So by looking at these physical characteristics itself, you can identify a preschool child. You can differentiate a preschool child from a toddler and from a school age child. So these are the main points we look for while looking at the physical appearance of a preschooler. Yes. Now going to the important measurements of height, weight, and mid-upper arm circumference. The weight of a preschooler increases 2 kg in a year, average 2 kg per year. And when we go to the clinicals and all, or when we are in the community, when we want to find out the ideal, what should be the ideal weight of a preschooler, we use the formula age in years into 2 plus 8. Then we know for a 4-year-old child, what should be the weight. For a 5-year-old child, what should be the weight. For a 6-year-old child, what should be the weight. The formula is age in years into 2 plus 8. Now here, the next measurement is height. In infant and toddler, we were calling it as length. Length because the measurement, head to foot measurement was taken in a lying down position. Here the preschooler is able to stand up well, and therefore we never call it length, we call it as the height because it is measured in a standing position. And the height, on an average in the preschool period, the child acquires a centimeter difference of from about 6.5 to 9 centimeters. The child can grow from the toddler period. Now, this increase in length, this increase in height is mainly because of the elongation of the legs. That means the legs are growing faster than the head and the body. And therefore, the height of the preschooler is attributed to the length of the legs. Now, in toddler, we were seeing the measurement of the head and the chest circumference, as well as in the infant age group also. We saw that the growth, in our growth and development, the principle is growth proceeds cephalocaudally from the head to the remaining part of the body. Therefore, in the toddler, the infant and the toddler age group, the head was growing fast, the head circumference was fast, and the chest circumference was slowly catching up. So by 2 years, it is supposed the head circumference is supposed to become equal to that of the chest. That is, the body is developing faster. So by the preschool age group, it should have been achieved. That is, the head circumference should become lesser than that of the chest. In other words, the chest diameter grows faster than that of the head. So therefore, that is again reflected in the preschool age group. We are not going to measure the head and chest because we already know, or we already understand by 2 years they should have crossed each other. The chest is more and the head is lesser. So therefore, we use another measurement called the mid-upper arm circumference. Mid-upper arm circumference is an indication of the muscle tone of the preschooler. We saw in the toddler, the muscles are not that developed, the child is wobbly. But by preschool, the muscle tone and the muscle mass increases, and that is very well measured by measuring the mid-upper arm circumference. So we know there are plenty of videos telling you how to measure mid-upper arm circumference. We measure it by holding the elbow, by flexing at the elbow. We take an inch tape. We measure from the acromion process of the scapula down to the olecranon process of the ulna. And we find the midpoint. From the midpoint, we place a tape around, and that measurement should be about 13.5 centimeters. Then the child is having a normal mid-upper arm circumference or a good muscle tone, which reflects nutrition and health in the preschool child. So here the main thing we have to know is we are not taking the length, we are taking the height in a standing up position, and we are not measuring the head and chest circumference unless we know the child is really retarded and we have a doubt whether there is a crossing over has taken place or not. And if it is a normal preschooler, we on one look we find it is normal, we go in for the mid upper arm circumference. Maybe for a 2 to 3 year old child, maybe we can confirm whether the crossing over has taken place or not. So preschooler, the measurements are the weight, height, and the mid upper arm circumference. Now I have told you about measuring the mid upper arm circumference, and there is a specific tape for that. It is a very big indicator in community level to identify the health status of the preschoolers. We use there is a Shakir tape available, and there is a infant and mother nutrition organization, their tape available. This one is that. So it has 4 colors you can see. There is a red color, orange color, yellow color, and a green color. So when this tape is wound around the mid upper arm, when the MUAC is less than 11 centimeters or it joins at the red color, the point of meet is at the red color, then it indicates severe acute malnutrition and the child should immediately be referred for treatment. If the mid-upper circumference is between 11 and 12.5 centimeter, that is at the red range. At the red range, in a three-colored tape, there are two types of tape I told you. In a three-colored tape, it stands as a red color, and when it is the four-colored tape, it stands as there is a orange color. So when the point of meet is at the orange color, it indicates moderate acute malnutrition, and the child should be immediately referred for supplementation. When the measurement is between 12.5 and 13.5 centimeters, yellow color, that is the severity is decreasing. It indicates that the child is at risk for acute malnutrition. The child is only at risk, may go into malnutrition. And just a counseling for the parent or the caretaker may be enough to bring up the child to the normal stage. If the MUAC is over 13.5 centimeters, that is a green color, it's a large area because many of the children are falling under this range. It indicates that the child is well nourished. So it may be above 13.5 to 13.5 centimeters. So this is the mother and child nutrition tape. It is a very big, useful, very big and very important, useful instrument in the community to identify malnutrition among the preschool children. Now let us see what are all the physiological characteristics. We saw physically when we look at the child how it should be, what are the important measurements that should be taken in the preschool period. Now let us see what are all the physiological body systems, how it is going to be. Now the first, head and skeletal system. We already know the fontanelles are closed, so never mention about the fontanelles in the preschool period. The head, as we saw, the limbs are growing faster, therefore the development of the head is slower. I didn't mean the brain, the head. The head and the skeletal system, the growth is slow. Dentition we saw already by toddler period. The primary dentition of 20 teeth is completed. Therefore, here it stands as such. Our duty is just to maintain the teeth, the primary teeth that has already erupted. Integument, we mean the skin and the hair. Here the skin, the pigmentation has begun to take place, and it is not like we see in the infant and toddler skin where it is the underlying fat is more. Here the muscle overtakes the subcutaneous fat, and therefore the skin is mature and pigmented, and it is not soft to touch. And the hair becomes coarse, dark and straight. Melanin, the melanin pigmentation, because of the melanin pigmentation. Coming to the cardiovascular system, the heart. Heart is 4 times the birth size, that is, it has reached the adult size. The pulse decreases and the blood pressure increases. So as we pass in stage, the pulse gradually decreases. We know the fetal it was 140, 150, then it became 100. So here the heart rate is only around 75 to 120. The heart rate is slowing down. It may be a range between 75 to 120. Since the heart rate is becoming lesser, the serious system is becoming mature, the vessel walls are becoming strong because of the muscle, and therefore the BP tends to increase. The range of BP lies between 55 to 90 systolic and 75 to 110 diastolic. So that is the BP range in a preschooler. We have already seen because of the development of the systems, murmurs are common and insignificant in the infant and in the toddler. But if they are going to persist again in the preschool children, then we need to investigate the child for the presence of any congenital heart disease. In coming to the blood, fat replaces the bone marrow in the long bones. Coming to the respiratory system. The respiratory system also, the respiratory rate slows down. It is varying around 20 to 30 breaths per minute. Maybe in the infant and toddler, we must have seen that we have to place a hand on the abdomen to measure the respiratory rate. In a preschool child, that is not needed. By looking at the breath itself, we can count the breath. And here the important thing we have to keep in our mind is the position of the eustachian tube. Because of the anatomical growth, the eustachian tube, which was very much slanted and therefore an easy passage between the throat and the middle ear, it has become straight, and therefore infections which tend to occur either in the upper respiratory tract or in the ear, they both are localized. They do not spread here and there, they stay there. And the tonsils and adenoids are well developed, and they function well as the first line of defense, and they control the infections there itself. Ear infections are common mainly because it is localized to the ear. It is not spreading to the upper respiratory system, to the throat. The GI system, it is mature. We saw that the enzymes have begun to secrete in the infant after the 6th month, and it gradually improves. So by preschool age, all the enzymes in the GI tract have begun to come to their mature levels, and the preschooler is able to have any type of food, and the bowel control is well established. The child is able to voice out whether the bowel is full and wants to go to the toilet or use the fresh area. Coming to the genitourinary system, it becomes mature at 5 years. Daytime bladder control is achieved. We saw toilet training was a big factor in the toddler period, and by preschool, the child is able to attain bladder control in the daytime. At night, it is variable. Some of the children have achieved nighttime control also. Many of them do not achieve. So, nighttime is variable, and it is not a cause for concern. About 600 to 750 ml urine is produced per day. Immune system, again, that is also well developed. The adult levels of immunoglobulin A are found. So antibodies are found to combat infections. We must be aware that most of the infectious diseases occur mainly from the preschool period. Many of our vaccine preventable diseases are found to occur here. Our immunization protects the children from these diseases, especially measles, rubella, chickenpox. All these are found to occur more during the preschool period. Coming to the nervous system, we already saw myelination has already over, and the child is attaining a good level of development. Another significant factor we have to see here is the cerebral dominance. Cerebral dominance relates to the right-handedness. If the left cerebrum is active, then the child becomes right-handed, and if the right cerebrum is active, cerebral hemisphere, then the child becomes left-handed. So we can see it at 3 years. The child begins to show which hand he is going to use most, and it becomes established by the end of preschool. So in a preschool child, the significant thing worth telling about the nervous system is the handedness, which you should not fail to mention. Right or left-handedness is established in the preschool period. The brain continues to develop, and by 6 years, the child's brain development is complete. So these are the various changes taking place in the different systems in the preschool child. Now coming to the sensory development. So what is this sensory development? How a child gives meaning to a perceived stimulus. When the stimulus is received, it is received either through the eye, through the ear, through the nose, through touch, or through our sense of taste and smell. So what meaning the child is going to give to the stimulus, that is how the child is going to interpret the sensory systems. How the child is going to see with regard to vision. Vision is going to be the last to mature. Visual acuity, it reaches 20 by 20 adult levels. Depth and color vision is established. But if there is a persistence of strabismus is cross-eye. So if the child is going to have that, it was normal during toddler and infant because of the development, immature development of the muscles. But here the muscles are well developed, and still if it is persisting, then it should be evaluated by the ophthalmologist. Here, the sense of hearing is well established. Taste, smell, and touch, which are the early beginners, which are there from the birth. The child is able to feel all those, the taste, smell, and touch, and it still continues to develop. Here, what is worth telling is about the food of the preschool child. We already saw the child is very active and the child is very picky with food. The preschool child is very picky with food. Till the toddler, you were able to either forcefully feed, but in a preschooler, it is not possible to forcefully feed the child also. Therefore, as parents or as caregivers, we have to worry very much about the color, the form, the flavor, and the texture of the food which we are going to feed the preschooler. Of course, the nutritional value has to be kept up, but in order to enable the child to eat by himself, all these characteristics should be taken care of in a preschooler. The color of the food, because what meaning, I told you, they associate meaning with the perceived stimulus. So how the color is going to appeal to the child. They may not like certain colors of food. They may not like certain forms, semi-fluid, or sometimes if it is very hard and rigid, dry, or sometimes some particular flavors and some texture. So the parent, as a parent or a caregiver, we have to identify and understand which type of food is nutritional and appealing to the child, and that has to be given, because in a preschool it is not possible to force the child to eat. Now we are moving on to our specific developmental areas. So till now we have seen how a child looks, what are the physical characteristics, what are the measurements which needs to be taken, and how the various systems are developing. Now, what is the gross motor development? Gross motor, we already know how the large muscles are going to be used in the body. So by preschool, I already told you the muscles and the bones have begun developing, and therefore the child is able to involve in a variety of activities. Uh, the child is able to walk, not only walk, the child is able to walk backwards. The child is able to run, the child is able to jump, the child is standing on one foot, the child is able to walk tiptoe, that is without any noise. The child is able to ride a tricycle and a bicycle. The child is able to hop when jumping on one leg. The child is able to climb the stairs, skip, throwing and kicking ball. So you can see the variety of activities, almost adult-like, but maybe you may not see the super fineness in adults, but the child has begun to involve in all these type of activities. So when we are going to assess the gross motor development of a preschooler, we first check whether the child is able to walk, then whether the child is able to jump or hop, whether the child is able to climb the stairs and throw a ball. So by the end of the preschool period, by around 6 years, the child is able to throw a ball well. So this gross motor development, as I already told you, it is because of the increased mobility and independent locomotion which is able to be acquired by the preschool child. The child is moving. In a toddler, the child was wantedly moving away from the caregiver in order to know about the world. In a preschooler, the parent or the caregiver themselves free the child in order to learn about the world. That is how the autonomy, the child wants freeness in toddlerhood, whereas in preschooler, the child is the parent themselves willingly let the child to explore the world because of their increased mobility as well as the independent locomotion which they are capable of. Now coming to the fine motor development. So fine motor development relates to the use of the smaller muscles of the body. So here the main achievement is gradually the reflexes are being slowly replaced by performance of purposeful, skilled activities. The child wants to do it, and the child is able to do it, and the child is achieving the act. So, when we are going to assess the fine motor, we check whether they are able to build blocks to keep one upon the other without falling down, whether the child is able to hold a pen and scribble, that is the approximation of the index finger and the middle finger. The child is able to hold the smaller muscles of the finger, whether they are able to put the pellets into a bottle, it is a fine activity, whether they are able to thread the beads, cut paper, buttons, color lines, fold paper. So the assessment tools which we use to identify whether the child is able to achieve these fine motor activities, very simple. It is available with all of us when you're going to the clinical areas also. If you're going to have all these, usually the habit is to assess a preschooler, we take the Chirikudka book, comic book, or book of activities. And in addition, if you are able to take these small items also, you will be able to wonderfully show or be able to make the child to exhibit their fine motor development, which shows the dexterity. Dexterity is the fineness or the clearness which they are able to do purposefully skilled activities. So this is the fine motor development. So we have seen how the muscles are able to work, the larger muscles and the smaller muscles, by means of the gross motor and the fine motor development. Now what about the brain of the child, the intelligence of the child? So the development here is called as the intellectual development or the cognitive development. Both means the same. It is the growth of the intellect or the brain. Cognitive development. So cognitive is the achievement of the intelligence. So we should know what is intelligence. Intelligence is the ability to adjust to new situations and to think abstractly, verbal and numerical skills and spatial relations, and also to reason or profit from experience. So if you are able to write by rote, if you are able to tell by rote, by heart from a book, so is that being intelligent? No. So you should be able to think abstractly, verbal and numerical. You should know how to manipulate them. You should know to manipulate verbal and numerical skills. You should be able to adjust to new situations. You should be able to reason, or you should be able to justify from your experience. So this is what we mean by intelligence. So all that is because of the development of the brain. Now, what promotes intellectual development? So there are some inherent things which helps in the development of intelligence, maturation of the innate capacities. So already genetically from the parent and from the grandparents, the child has derived some capacities. So maturation of these capacities are identified, and that can promote intelligence. Conditioning. What is conditioning? Associating a stimulus with response. When a stimulus is given and a response is given to that stimuli, and when we find it is good, we continue showing the response. When we find it is not good, we stop with the response. When we continue it, that is called as conditioning. That is forcefully we are being made to respond to a particular stimulus in the same manner. So that conditioning also gives a factor for intelligence. Reinforcement of appropriate behavior. So when we give a particular response and when we get a positive reinforcement, yes, very good, we get an appreciation, we proceed with that. So that when a similar situation occurs, we again act in the same manner. So that is intelligence. We are learning from our experience. Or when we do something and we get reprimanded, or when we get punished, we know that action is not good. Therefore, we do not resort to that action. There again, we are using the experience, the knowledge we gain from the experience. So that is also leading to intelligence. Imitation of others' behavior. When somebody is appreciated, we try to follow the same manner. It usually occurs in a family where there are elder children. When an elder children is appreciated by the parent, the younger ones tend to adopt that behavior. Oh, if I do that, I may also get appreciation. I will escape from punishment. So that also contributes to intelligence and insight. It is the what the child comes spontaneously from the child. So these are the main elements which frame the intelligence of the any person, and that intelligence slowly begins to be manifested from the preschool age group. Now we have a theorist here who has spoken about the cognitive development, Jean Piaget. So Jean Piaget has proposed the theory of intellectual or cognitive development. So she has discussed her theory under four main important themes: coordination of the various sensory inputs. So when various sensory inputs are received, how the child is going to coordinate and how the child is going to respond to that. Object constancy. Object constancy means whether the child is able to see that object or not, the child understands, yes, that object is there. For example, in an infant, if the mother is out of sight, the child cries. In a toddler, when the mother is out of sight, the child is able to tolerate for a very short moment. But in a preschool, when the mother is going to tell, I'm going out, I will be coming back at this time, the child is able to tolerate and the child will wait for that time. Yes, mother has said she will be coming at that time, and the child is able to so it is a honest word by the mother. The child sticks to that. The child knows even though that object is not present at that time, it will come back. So that is object constancy. The ability to use symbols. How the child is able to use the symbols, that is another main concept of intelligence. Whether it is a picture or whether it is a language, a letter in a language, how the child is able to utilize that symbol, how it represents. When the child is not able to explain a particular thing, the child makes use of these symbols. So that is a big intelligence. Egocentrism. Ego means we all know I, me, I. So that is ego. Egocentrism is the child viewing the world from his or her point of view. The child is not able to appreciate others' point of view. What the child sees, what the child feels, what the child understands, the child frames the world according to that. That is called as egocentrism. So preschoolers are able to focus only on one aspect of a situation. So let me give you an example. For example, if one of the child's grandmother or grandparents are at Calicut, and the parents are going to tell, grandparents are coming from Calicut. So in the mind of the child, Calicut denotes the living place of the grandparent, the house of the grandparent. So if the neighbor is going to come from Calicut, grandparents' neighbors, they are also coming from Calicut. The child will ask, how come when I came to Calicut, you were not there? The child is meaning Calicut as the home where the grandparents live. It cannot understand that Calicut is a big place, that not only the house of the grandparent, the neighbor also belong to Calicut. So they can focus only on one aspect of a situation. They are not able to get a broader view of things. So this is called as egocentrism. So here I'm going to, this is already I have used pictures which are available on the net itself, so that when you study also it will be similar to you. Here we can see the 4 stages in Jean Piaget's stages of cognitive development. The sensory motor stage, which expands from 0 to 2 years. The pre-operational stage, which is divided into pre-conceptual and the intuitive. We have the concrete operation and the formal operation. Here we are going to stick to the pre-operational stage because pre-conceptual, it is from 2 to 3 years. It has a small part of preschooler in it, and the intuitive phase which is from 4 to 7 years, again the preschooler is involved. Here, the thinking is dominated by perception. As I told you, how the child is going to perceive from the stimulus. But the child becomes more and more capable of symbolic functioning. Now, you should understand what is the term symbolic functioning. Symbolic functioning means the child has a faulty concept of time and causality. Causality is cause and effect. For example, a child may wish, when the child is angry with someone, the child may wish, I wish that person dead, I don't like him. So, in case by accident, if something happens to that particular person, the child thinks, oh, it is because of what I thought that this happened. The child is associating in a wrong manner. That is causality. And time. How we can tell the child is not aware of the time? The child is not able to differentiate between yesterday, today, and tomorrow, or maybe day and night. There was one preschooler whom I knew. The child was taught that after you sleep, when you wake up, it is morning. So the child has the routine. Whenever the child sleeps and wake up, the child immediately goes to the bathroom, takes the brush and begins to brush the teeth. So the child has understood the time in that manner. After I sleep and when I wake up, it is morning, I have to brush my teeth. So even if the child is going to sleep once or twice in the day, the child wakes up and takes the toothbrush. So it is a wrong association of time. So this is called as symbolic functioning. So symbolic functioning means awareness of wrong, it is a wrong concept of time as well as cause and effect. So that is symbolic. Language development occurs, child is unduly influenced by own perception of the environment. See, the child is influenced more by his own perception of the environment. The child jumps to wrong conclusions. So we call it, as I will tell you in the next slide. Yes. Readiness for school and scholastic learning, and a shift from egocentric to social awareness thought. So by the end of the preschool period, we know the main aim of the preschool period is readiness for school and scholastic learning. The child has to move from the egocentric to social awareness thought. So the child is involving in initial stages in the transductive reasoning. Now, this is another word, symbolic functioning we saw. This is transductive reasoning. Transductive reasoning is the child associates various thinking, different types of thought, and it comes to a particular conclusion. Because it is like that, it happens like that. There may not be any relationship between both. For example, anybody with a big stomach, the child will think that person is pregnant. Or if anybody is having a white hair, the child thinks they are old. So the child comes to faulty conclusions, thinking it has different thoughts. It combines those different thoughts and it comes to an understanding. It gives different reasons. Maybe I can tell you another example also. This child is giving an explanation. So when there were two children and one of the child was bit by a dog, the child was having restrictions in food. So the mother is giving him a different type of food. And the mother is, the preschooler asked, why you are giving him a special food? You are not giving that to me. The child, the mother answers that he has been bitten by a dog, so therefore he is being given a special food. The preschooler will ask, yesterday I was also bitten by a mosquito. Why you are not giving me the food? So the child is giving an explanation. It is having its own reason, and this is called as transductive. It is illogical. We can never explain why. But in the child's mind, it is right. The dog bit, he is getting special food. Mosquito bit me, I also need that special food. Okay. So that is transductive reasoning. Symbolic functioning, I told you. Magical thinking. Magical thinking, the child is living in a world of fantasies. The child has his own world. We know the child has not come up to the level of the adult and it is not able to perceive the world like us. So the thinking the child is involved in is called as magical thinking. So three important words which you have to remember when you're talking about the cognitive development is animism, realism and artificialism. So you must have seen all the cartoon channels on the TV. At least once we must have seen any of these cartoon channels. Okay, so animism, realism, excuse me, there's a call. Animism, realism, and artificialism. Animism, I've told you, we have seen various cartoon channels. In the cartoon channels, we have seen that a bird talks, a bear talks. So those things which do not talk, they begin to talk. They begin to have thoughts, they begin to have feelings. So this is what we call as animism, that is animate objects having life. I'm sure you are clear about animism. Animism means so things which are inanimate are given life, thought, and feelings. The child thinks, the bear is able to talk, they have their own feelings.
Excuse me, madam. Excuse me, madam. Somebody's
Yes.
Kasturiam. Please unmute and you are no, you are scribbling on the screen.
I have not scribbled. I scribbled.
No, ma'am. Yeah, it is scribbled by someone, Miss Kasturi. Now, Goshmi, please switch off that your sculpture. Ma'am, please continue. Sorry for the disturbance.
Okay, so animism. Animism means that inanimate objects are having life, they have thoughts and they have feelings. So another one more example I can give you, when a child is falling down. So you must have seen many people consoling the child. Oh, this floor only made you to fall. We will beat the floor. So the child is happy. So the child thinks this floor only made me to fall. This floor has received punishment, and the child becomes happy. So inanimate objects are given life, are given thoughts, feelings, and talk. So this is the feeling of the child. This is what we call as animism. Now, what is realism? In realism, the child is not able to differentiate real life from the imaginary world. So, in the imagination, or when the child is sleeping, the child may have a dream. When the child wakes up from the dream, the child does not understand that the dream is different, the actual life is different. Or what all the child has seen or what the child has feared from the dream, the child brings that into the real life. So, inability to differentiate between the real and the imaginary is called as realism. The child may have imaginary friends. The child may keep talking to that imaginary friends. We may think, what is happening? The child is talking. In the mind of the child, there is a friend, and the child is communicating with that friend. So, this is what we call as realism. Now, what is this artificialism? Artificialism is also a wonderful nature in preschoolers. They think that the whole world and the things around are born, are there, are existing for us. For example, the child is asking for a very costly object. The parent tells, see, I do not have money to buy that. The child will ask, why? Let us go to the ATM. The ATM is giving money. Why can't we go to the ATM and take money? The child doesn't know that unless we deposit money there, we do not get money. So artificialism means the child is not aware of the external things. The child thinks that all things are there for the child. So when you go to the shops also, the child does not know we have to give money and then only we will get things. The child thinks, oh, they are all there. It is my liberty to take any of it. So these are three important beliefs which the preschooler holds: animism, realism, and artificial. Animism means inanimate objects are given life and feelings in the preschooler's world. In realism, the child is not able to differentiate between the real and the imaginary life. In artificialism, the child assumes that the whole world is there for him and all things exist for him. So these are the important thinking or thought processes or the brain processes which mold the intellect and the intelligence of the preschooler. So what is the stage called? The stage is called as pre-conceptual thought and intuitive thought. Pre-conceptual means coming to an idea without having, so here the two important words we have to remember are the symbolic functioning, and in the intuitive phase we have to remember the transductive reasoning and the magical thinking. Yes, now let us watch this small video. Yes. Okay. So we saw it was a video of a Indian preschool child. You can see the child is taking up a vegetable, and the child is trying to cut the vegetable, or maybe is trying to pull out the seeds. Is trying to do some work. Okay. So this is my basis for the next topic, which is personality. There are different names for this development. It is either called as personality development, it is called as psychosocial development, or it is otherwise also called as emotional development. So from the words you can understand psychosocial, how the person, the child is going to interact with the society. The development between any person who is born into the world, into this world, has to live in the society, isn't it? We are social animals. So if we have to gain success in the living in the society, we have to pass through this psychosocial development. Now, in any stage of our life, as we grow up, we are confronted with a problem. So for this problem, we need to find a solution. In children, maybe because of their immaturity, they are not able to arrive at solutions, and the child requires proper guidance to attain this particular best solution. And if the best solution occurs, the child will have a functional harmony in adult life. So this is what we call as task. Every stage has a particular task. So this task has to be achieved successfully in order to move healthily into the next stage. It is just like passing our exams. If you don't pass the exams, you get a year back. In some streams, it's like that. Unless you pass that year, you are not able to move into the next year. So in development also, unless you achieve the particular task for that stage, you are not moving healthily into the next stage. The chronological age may increase, but in our mind, we are still behind, we are falling back. Now, if you see many adults, many of the adults are they are chronologically old, but in their mind, they have still not successfully completed these tasks. So therefore, they are not able to give for that particular stage what is necessary to be done. They are not able to give that fully. So the task for that particular stage has to be achieved. So now that is another important reason why we have to study growth and development. We have to help the children to successfully master these tasks and come out successfully, so that later they become adults who are peace loving. So most of the problems of today's life, which is shown by these adults, all these wrongdoings, many of them would have been preventable had these as children, when they had been molded properly, and they were able to achieve their particular task in their younger years. So there is a central problem, that is the task to be achieved. The Particular solution has to be found, and to attain that particular solution we need to give a proper guidance, and therefore the child will come out as a successful individual in later life. So here we have again I have shown it is again from the net only, so that you will be able to understand in its wholeness. I have not isolated preschool alone. Here you can see the task that has to be achieved is the sense of initiative. The task is initiative. If the child is not able to achieve initiative, the child falls into guilt. The child achieves guilt. Okay. So we have seen earlier in infancy, the child has to achieve trust. In toddler, the child has to achieve autonomy. So unless these two are achieved, we cannot expect initiative in the preschooler. If the child has chronologically achieved a preschool age, but the child is still thumb sucking, the child has not moved to the level of the preschool. Okay, so the preschooler has to exhibit the initiative. So in the video which I had shown, the child is voluntarily picking up a vegetable, cutting it on his own. Maybe he has two intentions. One is he wants to help his parents. Second is he is cooperating with his, we saw his elder brother running around. So maybe the elder brother has also done that. The child is also doing. So initiative means the child voluntarily comes out to do certain activities that will please or that is worthy of the world. So some activities like doing daily activities, helping a father or helping a mother voluntarily. So that is a initiative. If the child is not able to do that task successfully, either because of parental influence, that the parent is restricting, no, don't do that, or if the parent is going to scold the child, you have not done that properly, then that ends up in the negative counterpart, that is guilt. The child feels, oh, I did not do it properly, I should not have done that. Or so that is a very ill feeling which becomes a negative, and the child is not able to properly move into the school age. So initiative versus guilt. Initiative is the positive component, the task that has to be achieved, and guilt is the negative component which the child should not achieve. And as a parent or a caretaker or as a healthcare professional, we'll have to assess in the parent what were the factors which hindered initiative, or in the parent has to know what the parent has to do in order to foster initiative. Okay, so building initiative is the important task in the preschool. I hope I am clear. Initiative is the voluntariness shown towards doing activities which are pleasing to the adult and which are useful and purposeful activities which are useful for the world. So this sense of initiative is to be achieved during the preschool period. The negative counterpart is guilt. Erik Erikson was the theorist who spoke about the psychosocial or the emotional or the personality development of the preschool child. Here, so what are the special abilities that we find as a result of this psychosocial development? Separation individuation process is complete. Separation individuation means the child is able to establish himself as an individual. The child feels that he is independent from his parent. For the caretaking, the child is able to brush teeth by self. The child is able to take bath by self. The child is able to dress by self. The child is able to have food by self. The child is able to wear shoes by self. So slowly he is separating himself from the caretaker, and he is telling, I am an individual. I have my own thoughts. I have my own feelings. I want those to be respected. So the formation of an individual. So that is called as separation individuation. So this process is completed by preschool age. Energetic learning. So the world is for the preschooler. We know the child is not burdened by learning or other responsibilities, and the child as a toddler, he was not able to because he was no, his muscles were not well developed. Now in the preschool, there is no burden, the muscles are well formed, the child is active into life, the child plays, the child works, the child lives, enjoys to the fullest. So the maybe I would say the preschool period is the best because the child is not burdened by any social responsibility, as well as the child is not incapable of doing what he wants. So the best stage maybe preschooler, because they live the fullest life in a preschool period. So because of this enjoyable moment, their learning is also energetic. They grasp a lot of things. They observe because from their stimulus, from the sensory development, they receive all the stimulus. I actually know of a child who was able to just tell the name of all the vehicles, two-wheelers, just by looking at the light. So that much observation is there. Just by looking, we would think what is there in a light, rear light of a motorbike. By looking at the rear light, the child was able to name the vehicle. We should tell the names first. The child is able to recognize, not any other features. So their learning is so vast. You must have seen in a lot of WhatsApp videos, children talk, all the whole Tirukural they are able to tell. So their energy is to the fullest. And this is what we, as parents, we are not able to sometimes tolerate. A lot of memes occur from this questioning. Questioning is the order. So they have plenty of questions. Every time they are questioning, it is the curiosity. They want to know about the world. But how they understand is left to them. And it is the duty of the parent or the caretaker to be as much as simple and honest with the children. So to answer their questions in a simple and in a honest manner, because what they understand at this time, if it is wrong, it is going to be there with them for life. Therefore, questioning is the highest activity which we see in the piece. They may talk, they may live, they may play, but they have plenty of questions to ask. And here we find that preschoolers are willing to cooperate and they want to please the elders. In a toddler, we would have seen their favorite word is no, because they are developing their autonomy. So they want to disobey whatever is being told by the elders. In contrast, a preschooler loves to cooperate and it wants to please us. And sometimes it wants to please us so much that they go beyond their ability and they are not able to achieve it, and that may lead to guilt. So a preschooler shows plenty of efforts to cooperate. So a successful child who has passed the psychosocial development fully, has developed a sense of initiative, is characterized in these ways. They separate themselves as individuals, they show high energy for learning, they live life to the fullest, they are full of questions, wanting to know things, and they are willing to cooperate with the elders. Yes. The next development which we are going to talk about is the development of the child as a male or a female. So psychosexual development. So many of us have a wrong concept about sexuality. So sexuality is defined as a person's identity in relation to the gender or genders to which they are typically attracted. It is a sexual orientation. So here two things we can see. Identity in relation to the gender. I am born as a male. I am born as a female. So as a female, how much I am being a female. Sometimes we are not born as females. For example, I'm a female, but if I am typically attracted to either a female or if it is a male, how much I am identifying myself with a male. So it may be the same sex relation to the gender, what I am, or it may be attracted to whichever gender, either maybe a male or a female, a male being attracted by a male, or a male being attracted by a female, or a female being attracted by a female, or a female being attracted by a male. How much we are identifying with ourselves with that sex. A sexual orientation. This is what we mean by sexuality. So, development of sexuality again is influenced by the development of physical, mental, emotional, and socio-cultural areas of living. So, all these together combine to form our identity of sex. Okay, so the sexuality is influenced by all these areas. The distinction between sex and gender differentiates a person's sex. A person's sex, when we mean, it is the anatomical difference, how the reproductive system is anatomically found. So, how we call a male as a male or a female as a female. So we know a male, they have a particular reproductive system and they have particular secondary sexual characteristics. At the same time, a female has a different type of reproductive system and a different type of secondary sexual characteristics. So by that, we identify the sex. But apart from that, gender is given by the society. It is a social role based on the sex of the person. So if I am a female, what role I have towards the society? If I am a male, or I have a particular reproductive system and a secondary sexual characteristic, what I am supposed to give to the society? What is my social responsibility as a male? So this is what we call as gender identity or a sexual orientation and internal awareness. Okay, so this is what we mean by psychosexual development. So under psychosexual development, again, this is spoken of by theorist Sigmund Freud. We know he is very famous for a psychoanalytical theory. He was a wonderful psychologist. By talking to many of his clients, by going into their childhood stages, he has been able to frame this theory, the psychosexual theory. So here we can see the oral stage from 0 to 2 years, anal stage 2 to 3 years in the toddlerhood, and phallic stage in the preschool period, latency in the school age, and genital in the adolescent. So here in the preschool age group, we are going to talk about the phallic stage. The child learns to realize the differences between male and female and becomes aware of sexuality. This again I have taken commonly from the net. Now, phallic stage. So, phallus we know phallus means the initial anatomical structure of a reproductive system. So, the beginning of the reproductive feelings. So, phallic stage, the child understands till in the toddler period. In the toddler period, the baby just must have known if a child is wearing skirt or if the child has hair, it is a female. But in the preschool child understands there is an anatomical difference between a male and a female. It is not only the dress alone or the toys alone which determine a female and a male. Another important topic worth speaking in the psychosexual development in a preschooler is masturbation. Masturbation is touching the genitals. So here we must understand the child is just getting to know about the world, getting to know about himself or herself, has curiosity, and therefore is interested to touch his or her own genital parts. And it is not at all wrong. And the more we try to restrict the child, it becomes a problem. So the only thing parents or caretakers can tell is it is a private activity. It should not be done in public. So there is a curiosity. And a very beautiful concept again in preschooler is the Oedipus and the Electra complex. Oedipus complex, it refers to where the girl child has the boy child has an attraction for his mother. It is from a Greek god, the name Oedipus. Oedipus was a Greek god who loved his mother and he killed his father because the father was a interference in his attachment to the mother. So in the same way, Electra complex, the girl loves the father and thinks of mother as the enemy and or coming in the way of her attachment with the fathers. So the first attraction they have towards the opposite sex begins from the preschool child, the girl being attached to the father and the boy being attached to the mother. So this is called as the Oedipus and the Electra complex. Oedipus is where the boy loves the mother and Electra is where the girl loves the father. Another thing here, sex typing or sexual identity or gender role. I told you how the person is going to identify himself in the society, what social responsibility he is going to have in the society. That feeling is developed by the person who is the dominant parent. Whether the girl in the life of the girl, maybe the mother will be dominant. The mother will tell, you are a girl, you should be like this. You are a girl, you should dress like this, you should walk like this. So the child begins to understand in a society, if I am a girl, I should be like this. Or in a boy, maybe the father will tell, you are a boy, you should not cry. Many fathers say that. So the child is from small, he is trained that crying is not being a male. It is not in a society. A male will not be termed good if he is going to cry. So the gender role is built by the dominant parent, how a girl has to be and how a boy has to be. Maybe from the type of toys which is given also to the child. For the girl child, the Barbie dolls are given. For the boy child, cars, motorcycles, vehicles, equipments, tools, these are all given. So these are all sex typing or sexual identity or a gender role. So these are the three things Sigmund Freud is going to talk about in the psychosexual theory: the sexuality, the gender role, and the compartment of personality. There are three compartments in personality: the id, ego, and the superego. We saw in the infant, it is the id, that is the pleasure sense. Whatever the child is very selfish, whatever pleases the child is that terms that as good. Whereas in a toddler, it is ego. Ego is again the child, the I concept is big. The child is very selfish. Here in preschool child, the super ego develops. Super ego is the conscience. It is because of this conscience that the child is able to, the child is feeling the sense of guilt that he has done wrong. When the parents tell about right and wrong, the child is able to understand some things as displeasing to the elders and that has been wrong. So that the child, even if sometimes when the adults do not recognize that, the child feels within himself, I have done wrong, I should not have done that. So that little conscience that begins in the preschool age group, that is a compartment of personality. So Sigmund Freud spoke about the human suffering and pleasure principle. Pleasure comes in the preschool child by understanding about the genitals, by understanding the difference between the genitals, by masturbating, by touching, and also by having the first attraction towards the opposite parent. In the gender role, again, where Sigmund Freud's theory speaks about how society is going to view a male or a female, and therefore how we have to behave. That is built by the dominant parent. And the compartment of personality, the three compartments, id, ego, and superego. The superego makes its first appearance in the preschool period. Now, nowadays we find the child rearing has differed. Nowadays, parents are not rearing males in the same manner as it was done earlier, or girls in the same manner as it was done earlier. Now we can see girls are being brought up, so for them, for their own protection only, girls are being brought up strong and equal to a male. In the same way, males are being taught that being rigid is not being manly. You should understand a female. No, that's the concept now. In order to reduce violence in the society, we are building humanness. A human is not complete unless a male and a female component is there within him. A proper human should have 50% female and a 50% male characteristic. So nowadays parenting or we are focusing more on building humanness than on sex roles. Yes, so that was psychosexual development spoken of by Sigmund Freud. Now we are the next development we are going to speak of is moral development. Morality. Morality is the rightness and wrongness of things. What is right and what is wrong. So from here we are going to what is right. When we tell a concept of right and wrong, two important things need to be discussed: the respect for rules and the sense of justice. Respect for rules. Rules are formed by the society in order to have a smooth life. Life for me and life for the other person should also be smooth. So that is made possible because of the rules. So rules need to be respected. Rules are sacred because they are laid down by parents or those in authority. For the child, the rules are laid down by the parent. You have to wake up by this time. So there are some good rules which a parent lays in order to ensure the safety of the child as well as to ensure the proper development of a child. So the child has to consider these rules as sacred. Sense of justice means fairness. Equality, equality in the eyes of the child, in the eyes of the society. So justice, earlier the primal justice was, if you do me something, I will do the same thing back to you. That is eye for an eye, tooth for a tooth. So this is the sense, primal sense of justice. Initially it begins like. But in the preschool, as the superego has begun to form, the child begins to learn what is forgiveness, how we can let in, how we can give in and still become happy. So the moral sense is not acquired simply by following the rules of the society. So if you're going to blindly follow the rules, it is not a development. You are not developing a moral sense. So we have to imbibe it, we have to understand it, we have to experiment it, and it has to lead to our attitude. When we frame a strong feeling, we should be able to justify why I am accepting that rule, why I am against that rule, in the light of common good for the society. If I am going to break that rule, it is good for the society, therefore I am breaking that rule. So that is forming an attitude. So a moral sense, this is how morality has to develop, not by simply following the rules, but we have to understand the rules, we have to internalize it, we have to practice it, experiment it, we have to analyze it, and we have to know whether it is for the common good and then accept it, and it has to become an attitude. So that is the development of a moral sense. So this moral development was spoken of by the theorist called Colberg. So Colberg has spoken about a 6-step theory of moral development. Each the two are substeps of a main stage. Level 1 pre-conventional, level 2 conventional, and level 3 post-conventional. So level 1 steps. Step 1 punishment obedience orientation. Step 2 native hedonism, conforms to getting rewards and to have favors returned. Level 2 conventional level, it is from 7 to 11 years. So I'm restricting myself in the level 1 pre-conventional, younger than 6. So in the infant, we have seen right is what I want and what I get. And in toddlerhood, we have seen punishment, obedience, orientation. Not only in toddlerhood, in the very beginning stage of preschooler, in 3 years also, it is punishment, obedience, orientation. That is, if I am obedient, I will get rewarded. So good is what brings me reward. That is obedience. Bad is what brings me punishment. So that is called as punishment obedience orientation. I will not do bad because I may be punished. I will do good or I will be obedient because I will get rewards for that. That is the early preschool concept of good and bad. At the late preschool, we have step 2, native hedonism, conforms to get rewards and to have favors returned. So here we have the bargaining. I will do good, but you have to give me that. Okay, so I will do what you tell, you have to give me a chocolate. Okay, so this is called the bargaining. Initially it begins with bargaining. Hedonism means getting pleasure. So the child gets pleasure by doing things which bring him rewards, and it also wants to have favors returned. You gave me that reward, so I will be good to you. So that is bargaining. So this is the pre-conventional level, level 1. It has 2 substages, step 1 and step 2. In step 1, we have punishment obedience orientation, which is taking place in the 3 to 4 year age group of the preschooler. And we have the step 2, which is taking place in the 4 to 6 age group of the preschooler, that is naive hedonism, obtaining pleasure by sticking to rules and therefore getting rewards, and also giving back or receiving favors for the good that has been done. I hope I am clear. So these are the level 1 pre-conventional 2 substages which happen in the preschooler. Yes. So the next component of development is the spiritual development, Fowler. It is spoken by Fowler. Now let us see what is this spirituality. Spirituality denotes an idealized view of life. Anyhow, I am born. And in my life, what is going to be an ideal life? How an ideal life should be, and a personal freedom. It is a human universal. Universal means it is there in all humans, and it is expressed through beliefs, rituals, and symbols specific to the, it is not relationships, or it is specific to the religion and tradition. So we have a view of life, and that view we are exhibiting through our belief, through our ritual, and through certain symbols. So this is spirituality. In the higher level, spirituality means trust and reliance upon another. We believe and we rely. Rely means we are അവരുടെ മേത്ത് ചാരിയിരിക്കുക. That is reliance. We rely on them. That in case when we have any suffering, that suffering may be relieved. We may be relieved of that suffering by trusting someone and showing common loyalty to supraordinate. It is, or supraordinate means above the ordinary. We see someone as above the ordinary. We term it as God, and we form groups, common loyalties. So this each group have show loyalty to supreme being. So that is why we have various gods, because various groups are there. Each group rely on a particular god, and they believe that this god has value and power. And if we trust or believe that god, when we are in some suffering, our suffering may be relieved. We may be relieved of that suffering. So this is another concept of spirituality. It is also a way of seeing the world. World is a combination of living things and non-living things. How we are going to perceive the world in our inner eye. That is a spirituality. It is the faith acquires over time. We are not born with faith. When we live the faith slowly, the situations make us to acquire faith, and this faith may either deepen, that means we become stronger in that faith, or later when we begin to reason out, our beliefs may change over course of time. So spirituality, though the innate feeling is there that some supreme power exists, this faith may either deepen or it may change over course of time. So this is called as spiritual development. Now, it was James Fowler who spoke about the theory of religious or the spiritual development. So here we have again 6 stages are there: intuitive projective faith, mythic literal faith, synthetic conventional, individual, reflective, conjunctive, and universalizing. Here I am restricting myself again to stage 1, that is the intuitive projective faith. So in infancy, we have seen it was because based on the trust of the infant totally relied on the mother. It had faith towards its mother. The mother will satisfy the needs. Again, in this faith strengthened in the toddler period. In the toddler period, when the mother showed a particular form of prayer, the child blindly will do the same actions. Whether the parents make a cross, the child will put a cross. When the parents do it the Hinduistic way, they learn that, they learn to ring the bell. And when it is a Muslim faith, they learn to pray. So what the parents do, the child is doing. In the preschool period, the child, we know the child is imaginative and the child loves to hear. The child hears lot of stories from people around him or her, from the parents, from the elders, from others, lot of religious myths and stories, and they understand good and evil from that. So the child, based on those stories, the child develops the faith. So this is called as intuitive projective faith. Intuition that is gained from the stories and that is projected outside as faith. That is intuitive projective faith. Faith that is established based on the stories that are heard from the parents or significant elders. Excuse me, there is an important call. Excuse me, it was a very important call I had to attend it. So let me continue. So we had seen about the spiritual development. Now coming to language and speech development. So what is language? Language is a complex system of grammatical and semantic properties. Utterance of the language is called speech. Semantic. Semantic means meaning. So some words which give certain meanings. So language means we use certain words, no? Particular form. So there are words and there are rules how we have to use these words. So when we do that properly, it becomes a language. And when we speak it out, it is called as a speech. When we make sounds, we do not call it as a speech. No, when we use these words in a meaningful manner, we call it as a speech. Now, language can be both receptive language and expressive language. Receptive language means the language is understood. The child learns what it means, what the word means, what the sentence means. And when the child is capable of producing it, we call it as expressive language. So we have two types under language itself, receptive and expressive. Many of us understand certain language, but we are not able to talk it out, isn't it? So there we have only a receptive language. So receptive and expressive. Now this language depends on physiologic and mental ability, isn't it? So physiologic ability means we should be able to hear. Our hearing should be good. We should have a good proper mouth. We should have teeth. We should have tongue. We should be able to, then only the words become clear. So we should have a good upper respiratory, we should have parts of the head should be okay. Then only we'll be able to receive and we'll be able to express the talk. Now, what is this mental ability? Mental ability is we should have the intelligence to understand and speak it out. So, unless we have a good physiologic and a mental ability, it is not possible to bring out good language. Now, certain concepts which are worth mentioning in languages are articulation. Articulation is forming the words, how we are going to frame the words, how we are going to join the words and put them together into a meaningful whole. Pronunciation is how we are going to tell that word in the way it should be told. That is pronunciation. Auditory discrimination. So we should, when a person tells around 10 to 50 words, we should be able to differentiate between those words by means of our hearing ability. That is auditory discrimination. And fluency. Fluency is how often or how good we are able to apply that word to different situations. That is fluency, how we are able to tell it out freely and how we are able to apply it properly. So in a language, we need to have articulation, pronunciation, auditory discrimination, and fluency. Excuse me, organizer.
Yes, madam. Are you all right, madam?
My slide is not moving.
Maybe it might get stuck from your system, madam. Maybe just ensure like it is downloaded everything in your Zoom. Just ensure. Sometimes it might happen. Don't worry, madam. Take time and like try to don't give too much of commands. Then it gets stuck.
Okay.
Yeah, fine. Okay.
Thank you. Okay, now how is the language used in a preschooler? The preschoolers use long and complex sentences. So toddlers have just begun to understand come, go, sit, stand, or it may be come here. It may be a 3 or 4 worded sentence or a order. Here preschoolers, I already told you their vastness is improving. Therefore, they are fond of using long and complex sentences. So they tell it in a clear manner. So preschoolers are known for using long and complex sentences. And we already saw they ask plenty of questions to which we have to answer in a simple and in a honest manner. How about their vocabulary? Vocabulary is very vast. They are able to grasp in different languages, and different words, and the word ability is around 600 words per year. So that shows how much it is the grasping power is there. Create new vocabulary. I have a very wonderful example for this. When I was teaching the child from 1 to 20, 1, 2, 3, 4, 5, 10, after 10, 11, 12, and then later 20, 21. When I asked the child to repeat, the child was not, the 11 and 12 were not clear to him. The child made a new vocabulary. The child said 21, 22, 23. So it was a new vocabulary. Even today, I think, why it should have been 11 or 12? Why not 21? We have 21, we have 31. Why not 21, 22, 23? So it is a new vocabulary. Based on what idea they have, they create new words. That is creation of new vocabulary. Boastful. So they, because of the capacity of using the words and the ability to express their ideas, they are also very boastful. Another example I can give you. Once adults were talking, there was a preschooler in between. The adult was telling, yesterday a snake came into my house. So the child was asking, so what? Yesterday a rat also came to my house. So they never want to give in anywhere. They want to show themselves as superior, and they are able to use the words, and sometimes it makes us laugh. It is very good pastime being with children. That's how I have told what my passion was, interacting with children. So preschoolers are boastful. They are interested to use prohibited bad language. Sometimes, as I told you, the grasping power is very good. It is the duty of the parents and the elders who are in the midst of preschoolers to be careful with their language. The child grasps each and every word which is being told, and the child unknowingly may be repeating it. The parents may scold the child, so you don't use that word. It is a bad word. The child has seen a reaction, a thrilling reaction from an elder. So the child begins to use that word again and again. So preschoolers, we are promoting the preschoolers in using the bad language. So as elders, we should be very careful when we are talking in front of preschoolers, and we should not too much restrict them when they use any bad word, because the more we restrict, they try to use it more. Using monologue. Dialogue, we know it is a talk between two people. Monologue is the child speaking to self. I told you the child has imagination, imaginary playmates. The child, we may not be aware, we may see a child is alone. We may have, there are no children nearby, but the child will be talking to himself. That is a imaginary playmate. The child is talking to that playmate. So it is called as a monologue. And collective monologue. Collective monologue means there are 2 or 3 children around, and the child is trying to talk to those children, and none of the children listen, but the child keeps talking in the hope or in the feeling that others are listening. Actually, nobody may be listening, but when we are as adults, we know when we talk, when others don't listen, we either restrict or we call for attention. But the preschooler does not know that. So the child will keep on talking. So this is called monologue and collective monologue. It is a special characteristic of preschool talk. Monologue, talking to self. Collective monologue, again talking to others, fully knowing that others are not listening to the talk. Engage in telegraphic communication. So in telegraphs, earlier we had telegraphs, no? We give very short messages. We use the correct words so that the sense, the meaning of the telegram is understood. So preschoolers are like that. They use the correct words because they want to fully express themselves. So this is called as telegraph. Sometimes they may not use plenty of words, but they use the very correct words which will give the particular meaning which the preschooler wanted to convey. So I hope your language development under preschooler is clear to you. We are moving to the next part, the interesting part, that is play in the preschool period. Again, here I have given all the different type of plays in the different age groups: the solitary play, the onlooker play, the parallel play, associative, and cooperative. Out of this, the preschool child is involved in the associative play and in the cooperative play. In the early preschool child, we find the associative. Associative means they are there among other children, and there is a very loose cooperation among them. Sometimes I want to be with the child, I will play with the child. I want to withdraw, I will withdraw. So there are no strict rules or bindings as in a group play. So this is called as associative. Still, it is better from the parallel play, because in the parallel play, children are there, but they are playing to themselves. Here, they are trying to interact and trying to build a team. So it is a loosely formed team associative play. The type of play in early preschoolers, and as they become later into the school forming years and towards the end of the preschool period, they slowly begin to form small groups, and they begin to form play in a cooperative way. Yes. I don't know if you have seen any preschooler. They are highly imaginative. You just give them a small piece of chalk. As a teacher, I'm telling chalk. The chalk in the hands of the preschooler may be a car, it may be an elephant, it may be a helicopter, aeroplane. The child imagines it to be anything in the world, and the child will use that as a playing device. Dramatic play. The child is fond of role plays. As in sexual behavior, we have said the girls may try to put on the dress of adult females. Boys may dress themselves as adult males. They play cooking games. Girls play cooking games. The males play going out for job. Such type Superman games. They identify themselves as Superman. Sometimes this has gone dangerous also. So the preschooler has a high level and can involve in imaginative and dramatic play, and still it is associative, loosely formed groups have imaginary playmates. So the type of toys which we are going to give to a preschooler, we know they are capable of indoor games and they are capable of outdoor games also. The toys should be manipulative. It should give thought-provoking for the preschooler. How do I arrange it? So building blocks are a best example for manipulating puzzles, solving puzzles, jigsaw blocks of puzzles. The child will try to arrange it. Constructive play which is not going to affect the psychological being of the child. Constructive play. Creative play, which makes the child again to think and educational. So toys which are going to make, so if you put in the Netisel, you see there are lots of worksheets, joining, jigsaw puzzle, colors, different types, identifying animals, identifying shapes, color. So the workbook itself was created for the preschool child. So that much of thinking goes into the mind of the preschooler, and it is important for us to bring out that thinking and to develop on that thinking. They gradually move from pretension to actual. So they begin as a pretender. They pretend and imagine things, but towards the end of preschool, they begin to actually involve in such type of games. So maybe in the video which I showed, maybe the child initially would have seen a picture of a vegetable, the lady's finger. Now the child is actually taking the vegetable and it is trying to cut it. So it moves from pretending to actual. Now we have a complete understanding about the body of a preschooler, the mindset of the preschooler, the various type of developments, how the psychological, psychosexual development is, how the psychosocial development is, how the brain of the child is, how the spirit or the faith of the child is, what is good and wrong for the preschooler. Now, with all this knowledge in our mind, let us see what special needs the preschooler has as health professionals and as parents, how we have to understand what needs the preschooler has. Now, what are the emotional and social needs? So, preschoolers, even in adults, we have seen some adults are afraid of dragonflies, some about cockroaches, some on certain animals. All these fears arise from the preschool period. So as a caretaker or a parent or a healthcare provider, it is very important to see that in the preschool child, no fears may begin, but the fears should end at that stage itself. It should not be carried on to the next stage. So that we can provide by giving a strong sense of security that we are there, don't worry, it can be removed. So providing emotional support and how to express their need in a society, how they are going to, when they are going to interact in a society, we should be there to protect the child from any wrongdoings or from any wrong things the society is going to give to the child. So helping the child to interact successfully in the society. Preparation for school is a very big need. That itself is the main task of a preschooler. So, as a beginning for for school age, what are the things we have to prepare? First, the mind has to be prepared that the child has to achieve skills for living in the world. So, therefore, to achieve that skill, the child has to separate from the family and from the parent. The child has to be under the guidance of someone called a teacher. So these are the preparations the child, physical, mental preparations for the school. Discipline, progressing to self-control. Initially, it begins as discipline from the parent or the caregiver. We begin to tell the limit where the child should stop his misdeed or promote. Very good, carry it on. So later, the child has to form it as his own habit. That is progressing to self-control. Without any advice from others, the child has to learn to form certain behaviors. Yes, managing aggression. Aggression, the child is sometimes very violent, not to himself. In toddlerhood, that we saw the child harms himself, temper tantrums. In aggression, the child hurts others. That is aggression. We have seen many children biting, hitting hard, pinching. So those are how to manage aggressions. Aggressions may be managed firmly and with support. We should tell it is not a desirable behavior, how it will bring. We have to tap on the child's super ego, bring out that super ego so that the change comes from within. Egocentrism. Egocentrism is seeing the world from the child's own point of view. The child should socially be made aware of the social values and how the child, by keeping up with the social values, the child is able to live successfully in the society. So slowly bringing the child into the mainstream, socializing the child. That is how we have to manage egocentrism. Destructive behavior. Destructive aggression is attacking others. Destructive behavior is destroying things. So it has to be managed in the same way as we manage aggression. Development of self-esteem through initiative. The preschool child is showing a sense of initiative, isn't it? Voluntarily coming out and doing certain purposeful activities which are useful for the society. So when the child is involving in the initiative, as a parent or caregiver, we try to promote the child and we try to help the child to succeed in achieving initiative. That will build self-esteem. The child feels a sense of satisfaction. Yes, I am someone. I am able to do something. I will be a productive member of the society. So that is a need which we have to help to achieve in the preschooler. Handling fear and stress. We saw the three type of things in thinking, no magical thinking, the wrong causality of time and events. So that also has to be, that creates a lot of stress in the preschool child. The child sometimes begins to understand that it is wrong what the child has thought. Maybe the parent will help the child to understand. So that becomes a topic of stress for the child. So good support from the parent, both from the father and the mother and from respective elders in the family is essential for handling the fear and stress. And fear, as I told you, night terrors are there, nightmares are there. The child fears, lot of bad dreams occur during the preschool period only. So that has to be resolved towards the end of preschool period itself so that it does not reflect in the adult stage. Handling sleep problems, nightmares and terrors. So by comforting the child, by helping the child to understand there is a difference between the dream and the real world, by giving constant support. And sex education. We saw no the phallic stage. The child is at its highest curiosity to know about the respective body parts and the sex. Therefore, a responsible, very simple health education which will help to protect the child later from the society from abuse, as well as remove the habits of masturbation as it becomes older. So a responsible, simple, honest health sex education by members of the family needs to be addressed. Now, what are the physical needs in a preschool child? Dental health. We already saw the primal dentition is complete. Dental caries are very much prevalent in the preschool age group as a result of improper oral hygiene. Children may eat anything which comes in the way. I told you, the color, flavor, texture, they don't know which is good, which is hygienic, or which is healthy. So they have certain fantasies for food. That is why the advertisements are more focused, food products are focused on the preschoolers. So based on the advertisement, they may like the person, or the advertisement based on that they may like him. So such feeding habits may spoil the teeth of the children, and the child can have problems in teething. Therefore, we have to take care of the dental health. We have to teach them proper brushing and rinsing the mouth after food, and intake of proper food. Enuresis and encopresis. As I said, daytime control may be achieved in majority of children. Some of the children, enuresis may persist. Nighttime, it is variable. Some children may achieve, some may not. So therefore, again, supporting the child, giving a sense of security, that itself is enough to get the child away from this problem. Speech problems, stuttering and stammering. Maybe you may ask me, what is the difference between stuttering and stammering? Both are incoherent speech being blocked. When the sentence is being said, there is a block in the sentence. Stammering was used by the British people, and stuttering is used in the US. Both of them mean the same. Block in talk is speech problem. So again, that comes again from feeling of insecurity. The child should not be criticized or scolded for stuttering or stammering. But if we continue to support the child and give a feeling of confidence in the child, this problem may be removed. Accidents and poisoning, because of the increasing mobility and the curiosity. Lot of children coming to the casualties are the preschool age group. They may see something fantastic color. It may be a fantastic color which they like. So any liquid coming in that color, they just gulp it down. We have in the same way accidents because of the plenty of play they involve in. Drowning, fire accidents, during play, injuries. All these can be found during the preschool. So supervised, the child should be supervised. Though we leave them alone to play also, there should be at least one elder when they are in the playground or when they are at home. There should be supervision. Same way, the house conditions should be modified for safety of the child. Like electrical appliances, holes should be kept closed. The switches should be out of reach of the child. Such things. Child abuse and neglect is a very big problem today. As I said, many adults have still not crossed their psychosocial or psychosexual needs successfully. They have not achieved that task. So in form, they are big adults, but in their minds, they are still underdeveloped. And that leads to this child abuse and neglect. So it is our duty to again supervise, make them aware. A lot of materials are now being created to make the children understand about the abuse and neglect, how to identify and where to report. Such things are there. 1098 is the helpline number to report for child abuse and neglect. Um, it is a need in the child which we have to observe as a healthcare provider. Sometimes we may see the child coming with cuts, bruises, which are not at all necessary. So later on, while giving a good talk, only the child will come out to tell. So what is good touch, bad touch, all that comes under child abuse and neglect. Now, what are the nutritional requirements in a preschooler? Calorie. How much of calories the child should, it varies from 90 to 100. It is slowly reducing as the stage progresses. The calorie requirement is reducing. It is 100 kilocalories per kg per day, maybe 90 to 100 also you can tell. Protein is more requirement is more in the children because their muscle mass is developing and they are growing. So 1 gram per kg per day is the recommended protein allowance in a preschooler. Fluids 90 to 100 ml again per kg per day. So whatever the child plays or walks around or is involved in the world, it is the caretaker's duty to see that in any form this amount of calorie, protein and fluids are reaching the child. The daytime sleep maybe only one may be there, maybe 1 or 2. The nighttime sleep should be around 12 hours so that the brain and the body grows and repairs and the child is fresh for the next day. Booster doses in the immunization schedule are there around the preschool period, which needs to be attended to. Now, when we see a preschooler, what are the things we can anticipate? What problems can be there in a preschooler? We should talk to the parents during the end of toddlerhood itself. The child is entering into preschool. These are the needs your child will have. These are the problems you can expect, and you have to prepare on this way. Okay. Now, or in a preschool child itself, we can educate the mothers. These are the problems that can arise, and this is how we have to handle. So malnutrition, which initially occurs in the toddlerhood, which may progress if unattended, it may progress to the preschool age group. Vitamin deficiencies like vitamin A deficiency, these are also important problems which we see in the preschool age group. So when we are doing the health assessment, we have to look for malnutrition and deficiencies in the preschooler. Skin infections. As a result of playing outside in the mud, the child is prone for skin infections, especially the group A beta hemolytic streptococci, the scabies, all these infections tend to occur in the preschool age group as a result of playing outside in the mud. And we need to address those. Dental caries, I already told you. It is a health problem. We have to look into the teeth of the preschooler, and we have to teach good oral hygiene in the preschooler. Tonsillitis and adenoiditis. Almost many of the surgeries which occur in the ENT department occur in the school age group is this tonsillitis and adenoiditis. It is a common health problem. I told you it is the first line of defense and it is very active in the preschool age group. And therefore, 90% of the preschoolers have enlarged tonsils and adenoids, but we do not remove it because it still has its work. And that's why nowadays we are not removing at all. Earlier in the school age group, it was removed because it was swollen and it affected the swallowing, and also it led to further infections. Worm infestation. So it is another very big infection in the preschool age group. Worm infestation we can make out by seeing the patches in the face. We can see that the abdomen is bloated. The child has anemic symptoms. The eyes are yellow and not brightly colored. And the child shows an interest for taking non-nutritive substances like ash, chalk. Earlier there were bulbums. The child was fond of eating mud. So this is unedible things being eaten fondly by the child is pica. This is a result of worm infestation and also vitamin deficiency, consequent vitamin deficiency. So we have to ask these questions or look for these in the preschool child when you encounter a preschool child. Most of the vaccine preventable diseases, which I said, like measles, rubella, chickenpox, they all make their appearance in the preschool age group. Now, because the immunization is strong, the coverage is good, we are not seeing much of cases. Earlier, most of these cases were identified during the preschool children. Almost I'm at the end of the topic. I hope now I have not told about the assessment of the preschooler, the growth and development assessment. Growth, as usual, we use the growth chart. We have the, it is extending up to 5 years, 1 to 5 years WHO growth chart. Plotting the height and weight on that, we can understand. And the mid-arm circumference is a good identifier of the nutritional status of the preschooler. For assessment, we have the simplified version, the Trivandrum Development Screening Test, which you can look into. It is the simplest form of the Denver Development Screening Test. We have certain activities we look for, which should be done by the preschooler. For some gross motor, fine motor, and some thinking activities. If the child is satisfying that, the child has developed adequately. That is the assessment we find. I also told how to assess for the different systems, what are the vital signs, what needs arise in the preschool children, what are the problems you should look for and try to, and in what way we can help the preschooler to attain, to satisfy the tasks successfully, how to accomplish the task successfully and move happily into the school age period. I have not told about the ICDS or the Anganwadis, which are having a very major role. We have to really thank the Anganwadi teachers, especially in this Corona times, because they are taking the rations to the home and delivering them. My research was actually in the tribal area. I have seen Anganwadi teachers, how they carry the bag full of wheat to the preschool children, the children who are situated high above in the hills. The Anganwadi teacher walks. A big salute to the Anganwadi teachers, the ICDS centers who are providing the growth monitoring benefit, who are taking care of the minimum health problems, and who are providing the supplementary nutrition. Preschool is not complete without ICDS. Due to lack of time, I'm not dealing into the preschool education and the preschool under 5 clinic. I'm not going deep into that. Still, there are, I told you, the children are energetic, no? Here I am showing you Mr. Ayan Gogoi Gohain. He's an Assamese 4-year-old child. He's the youngest author in India. He has written a book, Honeycomb. It was his own thought. I told you they have a lot of imaginations. All that imagination was put into writing, as he said, and he has bagged the India Book of records. He has got a place in that. I'm happy. There are many children I would have left out, just to show you that preschoolers are wonderful and they need to be appreciated and promoted. I have put up this slide. Thank you. I hope I have satisfied your need to know about preschoolers. I have exceeded the time also. Still, if there are questions, you can ask me. Thank you so much for the opportunity. Organizer.
Thank you, ma'am. Grateful to you for the fantastic session. Now it's time for question answer section. Dear delegates, you can clarify your doubts.
Hi, Professor Radhi Madam. It was really an extensive and very fantastic session that you have been chat for last couple of hours. You know, as we have gone beyond the time limit, but still we have all participants patiently listening our sessions. Though initially there were around 500 people in the Zoom and 100 people, around 150 people are watching onto the YouTube. And I feel that proud that like still our students, especially nurses, especially in academicians from different parts of our Kerala and from outside Kerala as well, being a part of our program for last 3 days. So that shows like a kind of motivation for all of us, including our resource people as well. And thank you very much from as a principal of Lourdes College of Nursing from my side and from my management for taking your time and effort in spending with us for last couple of hours and accepting our invitation very pleasantly. And thank you very much from my bottom of heart. Thank you, madam.
Thank you very much.
And dear participants, thank you for your patient listening. If you have any questions, please put forward to us, and our madam is willing to share her knowledge. Please. I know the time is beyond limit. If not, like we will go on to the vote of thanks, Mr. Sriraj. And I'm kindly reminding all the participants, please be available for next couple of days program also. And there are another two resource person are going to present on 2 different topics again. And thank you.
Gratitude opens the door to the power, the wisdom, the creativity of the universe. Now I invite Mrs. Jasna Joseph, lecturer, to deliver the vote of thanks.
Gratitude is not only the greatest of virtues, but parent of all others. Good afternoon to all, respected dignitaries, teachers, students, and participants. I, Mrs. Jasna Joseph, deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to Almighty God for making today's occasion a resounding success. First and foremost, I owe sincere gratitude to Professor Riddhi M., Principal, Almas College of Nursing, Malappuram. Thank you, Madam, for your wonderful session on growth and development of preschoolers. We are thankful for your time and effort made towards making it a memorable one. Your lecture was impressive and would certainly benefit all of us from the breadth of knowledge and depth of expertise. Thank you, Madam. And also, I express my heartfelt thanks to Mr. Santikumar T., Principal, Lourdes College of Nursing, who is the backbone of our institution, for his valuable contribution and support. Thank you, sir. I thank Mr. Johnson L.K., Vice Principal, Lourdes College of Nursing, for his unstinted support for this function. Thank you, sir. My heartfelt thanks to our dear HOD and moderator of today's webinar, Mr. Sriraj RN, and all our head of the departments of various departments and the faculty of their valuable contribution, guidance, and encouragement in all our efforts. Now, I would like to thank all the students and those who have participated in this webinar. Thank you very much for your unwavering attention throughout this webinar. Once again, thank you, one and all. Thank you.